Hey, Christy, welcome to Talks with Tina. This is a really fun video series that we're putting together to provide insights to our clients, and I'm just really excited to be here with you. And I guess a little background for the viewers. Christy is a managing director and a colleague of mine in the life science and healthcare practice at Deloitte, and she's also a national consulting leader for our Deloitte's provider pricing practice. Christi has more than 25 years of experience in both industry and consulting in the areas of large-scale operational improvement, pricing strategy and execution, cost reduction across multiple sectors. I think these experiences have really helped enable a unique cross-industry perspective to your work. And I know, Christi, you're passionate about increasing the access and affordability of healthcare through information transparency, meaningful patient experiences, and data-driven decision-making that accelerate the future of health. And I mean, everybody wants to do that, right, Christi?
That's right, Tina. Yeah, I've spent, and I think most importantly for our viewers for this particular topic, I've spent the last several years doing pricing for our provider clients, both holistic pricing strategies, and in the last 18 months to 12 months, really focusing in on their price transparency and the information transparency imperative and the preparation they need to do for it.
Yeah, and so let's talk about pricing transparency. You know, it's such an important topic to our industry, and why is it important now?
Yeah, it is. And you know, thinking about it longer term, I mentioned earlier, this is price transparency as a topic has been around since the early 2000s. And with the ultimate goal stated even as far back as then as trying to get to the true cost of a service to inform patients in a meaningful way that they can shop around and take healthcare decisions into their own hands. And that really points to, I think, some of the longer term challenges for our clients. The price transparency rule is intended to fully disrupt the market with two aims. More consumerism and more competition. But I think why the urgency now is there's the recent regulation that was signed last November by President Trump really kind of put a burning platform to adding what most providers would consider very confidential information into their rates,
Right.
specifically their rates, and between payers and providers. And regarding that as highly confidential, many of our provider clients have worked for decades on getting their contracts exactly where they want them with their payer partners, and exposing all of that publicly is really kind of the thorn in the side of all of our providers and our payer partners right now, and it's something, though, that I believe is really going to drive the competition and consumerism that is important right now, and is a big focus for both the current administration and I think for our society nationwide.
Yeah, no, it makes sense. And I can understand if you're, a healthcare executive, like sharing all of your pricing, like that's the secret sauce, and it opens up Pandora's box with a lot of questions. So definitely something to think about. So what should our client leaders think about as they consider these challenges and the ramifications of it all?
Yeah. So the challenges are multifold, really. There's an immediate near-term challenge, I think, really focused on the compliance aspect. This is a very heavy lift for our clients, our provider partners, and the plans too. It's resource intensive, it's analytically intensive to produce the files, specifically the machine readable file disclosures that the regulation requires, and to create a consumer friendly and, more importantly, an accurate and complete liability estimate for patients is just something that I think the industry has struggled with for a long time. So those challenges are very immediate. For providers, that takes effect in 3 weeks from now on January 1st, 2021. And for our plans, it takes place 1 year later. And, I've in talking to one of our large provider clients, a nationwide healthcare system, they have to produce 120 million data points for this one file. And so just the compliance is a very heavy lift.
Yeah, 120 million, that's crazy.
Well, and that's just the file, right? There's also the liability estimation tool, which has been notoriously difficult for our clients to get. And we did a survey actually recently of of some consumers, healthcare consumers in the New York City area, to kind of understand what they felt like accurate meant to them. And they said ultimately they want no surprise billing, which is a hot topic across the nation. And then also they want something within a 10% range of accuracy as a complete estimate. And that is, that's just a challenge for both payers and providers alike. Patients are unique. The services they need are unique, and to price that before even being seen by a physician or by a provider is a complicated task.
Right. Well, and then you get your explanation of benefits, and most people don't really understand it anyway. So trying to be within a 10% window will be challenging.
Well, and from a completeness perspective, adding the physician element has been always a challenge, right? You get the hospital bill, and then,
oh yeah,
2 months later, here comes another physician bill. And
yeah, like the radiologists and the anesthesiologists, they're all separate. So then when you try to put them all together, it's difficult.
For the first time, and this points a little bit to interoperability too, for the first time, patients are going to have complete access and control of their medical record. And having that combined with price transparency is going to make it very easier. Well, I'll say it this way. It's easier than in the past to carry your medical record around and go shop around for what you truly believe is high value healthcare. And in this case, Deloitte defines that as a combination of their cost, a combination of quality defined by outcomes, but then also accessibility. It's no good if it's 40% cheaper and you get better outcomes, but you can't get in to see a physician for 6 months. So I think it's the value to the patient is really that. And then for plans, patients aren't necessarily their ultimate consumer, but large employer groups are. And
right.
Having all of this data out there for large employer groups to shop around and really, I think the brokerages are going to be really faced with a stiff challenge around competition.
Great. Well, so pricing transparency, big issue, providers January 1st of 2021, and then payers a year later. And my takeaway was the goal is to push more consumerism and more competition. So we'll see if it really happens. Any closing thoughts from you, Christi?
Yeah, I would comment that, our leaders in healthcare really need to sit down and think about what they want. So many of them are having a very visceral reaction to the compliance and putting their rates out there. And I think if you can take that hat off just for a second and think about what the market will look like, say in 2025, and start investing now in what you think the pricing strategy should look like. We really believe that it's going to become much more consumer oriented pricing, where there is a focus on your value narrative, and putting together, investing in that value narrative, making sure everybody's speaking the same language, because ultimately we're going to get to a point where your brand has a value in the market, whether that market is with patients or with large employer groups for plans, and really doubling down on the consumerism aspect and making sure that your patients are having a frictionless, easy experience when it comes to pricing and accessibility of our healthcare services.
That's great. Well, listen, thanks so much. It was a pleasure catching up with you, and I love everything you're doing to help our clients and move this really important imperative forward.
Thank you. Good to see you.
Thank you.